Signs and symptoms of arthritis and what to do. Your joints and bones play an essential role in your life. Healthy joints allow you to move freely and perform simple tasks like walking, running, jumping, bending down to grab stuff, and much more. If your joints get affected, you lose your ability to move freely without any discomfort. Arthritis is a condition that negatively affects the health of your joints and causes inflammation and wearing. The most common types of arthritis that damage your joints are osteoarthritis and rheumatoid arthritis. Osteoarthritis occurs due to overuse and degenerative changes that occur with age. In this type of arthritis, the cartilage between your joints wears away over time, and other degenerative changes are seen on the joints that carry the most load throughout life, like the knees. On the other hand, rheumatoid arthritis is an autoimmune disease that usually affects the smaller joints. Osteoarthritis is common among older people, while rheumatoid arthritis occurs much earlier in life. However, it can be present at later ages as well. If you often feel pain in your knees or ankles when moving, chances are you might have arthritis. Pain is the most common and primary symptom of arthritis. The inflamed joints and degenerative changes affect the structures and soft tissues surrounding your joints. Your muscles overwork trying to save you from painful movements and strain out. All of these factors result in pain in the affected joints. Swelling in the joints is a common sign of arthritis. In rheumatoid arthritis, the tissue surrounding your joints, also known as the synovial membrane, is inflamed and thickens up. The fluid builds up inside the joint space and causes erosion. You might be able to observe swollen finger joints with rheumatoid arthritis. Things work slightly differently with osteoarthritis. The tiny bone growths and reduced joint space in weight-bearing joints result in friction and swelling. The most common site of swelling in osteoarthritis is the knees. Morning stiffness is common in both osteoarthritis and rheumatoid arthritis. In any case, you experience stiffness in your joints when you wake up in the morning. However, the duration of stiffness in each condition differs from the other. In osteoarthritis, stiffness is often experienced in your back and knees and usually lasts less than 30 minutes. Stiffness experienced by people having rheumatoid arthritis typically lasts for hours. It is generally present in smaller joints like the fingers. People with arthritis often experience changes in their pain severity throughout the day. The pain from osteoarthritis usually worsens with activity or as the day progresses. The more you work, the more you feel fatigued and feel pain in your joints. In rheumatoid arthritis, the pain vanishes with activity. It is the worst in the morning, and as the day progresses, its intensity somewhat reduces. As the severity of arthritis progresses, you may experience reduced ranges of motion. While pain and swelling are a major contributing factor in reducing the joint movement degrees, damage to the joint itself also restricts motion. In osteoarthritis, the space between your joints lessens over time and the cartilage erodes. Your knee movement becomes restricted over time, if not provided with proper interventions. Do your joints give off popping sounds when you move? Crackling and popping sounds, also known as crepitus, are often observed in arthritic conditions. Occasional popping sounds are not severe, but if you regularly experience popping and crackling noises from your joints when you move, bend down, or walk, it usually indicates weakness and arthritic changes in your joints, especially if these sounds are accompanied by pain. Besides pain, swelling, and stiffness, the skin over your joints with arthritis often appear red and are warm to the touch. This is because the inflammation of the joint increases the blood flow in the surrounding area. Weakness and muscle wasting can be present in arthritic conditions. In arthritis, reduced ranges and the inability to perform everyday activities normally can weaken the muscles surrounding your joint over time. When muscle groups are not used for extended periods, they get weak and lose their bulk, also known as muscle atrophy. Sometimes fever is also observed in arthritic patients. The substances causing inflammation in your joints can be a cause of increased body temperature. Fevers are more common in infectious arthritic conditions. If bacteria or viruses enter your joints, they cause infection and inflammation, consequently causing a fever. Rheumatoid arthritis also increases the metabolic rate, resulting in a fever. Arthritis can be debilitating if it worsens. However, an early diagnosis may help prevent complications. Doctors diagnose arthritis using your medical history, performing a physical examination, getting x-rays, and blood tests. Since there are many types of arthritis, identifying the right type allows your doctor to determine the best treatment. It's also possible that you have multiple types of arthritis at the same time. In the physical examination, your doctor may look for deformities and nodules. Muscle atrophy, muscular weakness, and skin redness are also assessed. Nodules on fingers and palmar erythema are common in rheumatoid arthritis. In osteoarthritis, bony enlargements, crepitus, tenderness, and reduced ranges of motion are commonly observed. Once the type and cause of arthritis is determined, your doctor may use treatment approaches that your condition requires. The most common treatments include medications, physical therapy, and surgery. Physical therapy can be helpful as an early intervention to manage and improve the symptoms. Physical therapists also provide detailed do's and don'ts guidelines while performing physical activities, as specific postures and movements may worsen your condition. If physiotherapy intervention fails or the condition worsens, your doctor may suggest a joint replacement, repair, or fusion surgery. Some lifestyle changes and healthy habits can assist you in protecting your joints from degenerative arthritic changes. Eating a properly nutritious diet and regular exercise keeps you fit and your joints flexible. If you are overweight or obese, losing weight can reduce the pressure on your joints. Heat and cold packs are effective in reducing pain. Additionally, assistive devices help perform everyday tasks efficiently by helping in movement.